Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Health Adviser. Welcome, Dr. Raja.
Thank you, Madison. Happy to be here.
Our topic today is people using psychedelics to treat mental illnesses. Dr. Raja, what are psychedelics?
Sure. So psychedelics are different compounds that can be found or extracted from some plant material. So the two big ones that people discuss or is in discussion currently is something known as MDMA or methylene methamphetamine, and also psilocybin, which comes from mushrooms.
So why are people using them to treat mental illnesses?
So they've noticed that when people who have severe PTSD they're not responding to any other drugs out there, if they are given these psychedelics, mainly the MDMA and psilocybin, they've noticed a dramatic improvement in their PTSD symptoms to the extent where they no longer get classified as even having PTSD anymore. So it's proven very successful in that subset of patients. So now they're beginning to wonder, should we perhaps look at these as medications? Can we look at them as medications to treat certain mental illnesses or certain conditions that fall under the realm of mental illness?
So what are the safety concerns and potential risks of using them?
The worry is, what if these medications or these compounds are used in some other illness, not necessarily PTSD, but some other spectrum of disorder that may fall under mental illness. But what if they start using these medications in those illnesses? We don't know yet the extent of what could it do to the patient besides just maybe it'll cure them, but are there any side effects? How long should we use it? Who should be prescribing it? Who should be delivering it? All those are questions we still haven't answered. So the worry is just using it for one type of illness. Do we risk the use of this spreading to other illnesses without getting tested or doing an analysis prior to that?
So how do psychedelics affect the brain and mental well-being of someone with a mental illness?
It alters the brain chemicals that are there to ensure that it brings about the balance in the chemical imbalance that exists. The chemical imbalance is what leads to what we refer to as a mental illness, but with the use of these compounds, can we restore that imbalance in the chemicals in the brain? And if we can restore that, then that mental illness, so to speak, will not be there, and that problem won't exist.
So how does this directly affect college students?
Even though this medicine is indicated for this disease, sometimes people will prescribe the medicine or it'll get prescribed for a different disease. Now, that's called an off-label prescription. Now, without doing tests and having research done, if people start using it off-label, then we don't know what that could do to the population. We don't know what impact that will have on people if they're using it when they probably shouldn't be using it. So that becomes worrisome for college students, for example, if they happen to get their hands on it and they self-prescribe it. That's never a good thing to self-prescribe any medicine. It's always a good idea to go to a physician who is trained to prescribe that medicine. So we want to set up that framework and say, you can only use this medicine if you go to this doctor and they prescribe it to you. So that's what they're working towards.
Any last thoughts?
No, the main idea here being there's likely going to be a lot of changes or a lot of thought and effort put into building a system around these compounds and trying to decipher if they should become medicines and how best to put these medicines out there for people who actually genuinely, definitely need that.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.